I'm Rebecca Cook with Bella Pilates, and I wanted to teach you some ways that you can use trigger point therapy with a massage ball to roll out your glutes. This is a region where if you don't know how to properly support with your core and you're standing and you're up and about throughout your day, you can get into the habit of actually kind of sinking into your hips and squeezing your glutes for support instead of supporting from your center, from the core muscles. And so those gluteal muscles can get very tight. It can cause some compression in your spine from slouching and just be very uncomfortable for you. So I'm going to go through a few areas. Now, when we think about the glutes, we think about two nice round butt cheeks here, right? And we have some bony prominences. We have the PSIS joint behind and underneath that upper pelvis. So you're just going below the spine. And then you also have your sacrum bone. It's like a triangular shaped bone that is right underneath your spine. It's a fused spine underneath your lower lumbar. And then you have your tailbone. You also have your sits bones that are the bony prominences underneath your tush. So when we look at this glute area, what we're going to do is we're actually going to start towards the outside of the glute. You want to make sure you're not on the bone, you're just to the side of it, and you're just going to work your way down about 2 inches. Okay, so we're working in this top corner of your glutes, what you would consider your whole glute complex. Then we're going to come down closer to the greater trochanter area on the side here. And then we're going to kind of work our way towards the tailbone so that we're hitting closer to the area of the piriformis. And then we're going to kind of go alongside the edge of the sacrum. So I'm going to take off my shoes so that I can lie down. When we get into this position, you can of course do this on your bed. You can also do it on the floor, on a mat. I happen to be on my Pilates Cadillac. I love using these soft spiky balls. They are not sponsoring this video, but if you go to Balanced Body's website, pilates.com, and you look for soft spiked massage balls, you will find a host of different sizes. I believe it goes from green to orange. I have the yellow. It's a kind of in-between stage. I also like the red. I would typically say yellow or red for ladies and red or blue for men. Just a little heftier. They're not necessarily harder. I like the little spikies because these are not super hard. They are harder than Franklin balls, but they do dispense the pressure a little bit. If you do not like having the soft spiky balls, you can always go to a tennis ball, or I also have, let me find it here. Sorry, I didn't have it ready. I also have things like this. This is a very soft 1 pound ball, and you can lie down on this. So if you have issues with sensitive skin, you prefer Swedish massage over deep tissue massage, you may want to go for something like this, okay? So you're going to lie down on your back with your knees bent, and we're going to find, like I said, the outside corner of your glute complex. So we're really kind of hitting that gluteus medius and minimus right away. So if I'm just straight up and down, I'm not going to feel anything. I have to tilt my body towards that side, and you should feel somewhere in there, you might have to just sort of knot. That is what a trigger point is. It is a knot of the muscle fibers, and it causes the muscle fibers on either side of that knot or nodule to get very thin and weak. And so we want to release them. Typically, we just hold on that position for about 10 to 20 seconds. Sometimes if you are really tight in a certain area, you may want to relax and breathe and hold it for up to 1.5 minutes. Once you've held it for 10 to 20 seconds, you're just going to move it down along that outside edge and find another trigger point. Okay, so you're trying to find those places that feel like a little bit of a bruise, a little bit of a knot. We're kind of right on the outside edge of those glutes, and we're just breathing through it. Okay, so we're not going to spend a lot of time in this video pausing, but what you can do is you can pause the video if you need to follow along, and then you can come back to it when you're done. So now I'm skipping a little area and I'm moving closer to my greater trochanter. So you know all those cartoons of a bone that has like that little, two little humps on the edge of the bone, at the end of a bone? That's what your greater trochanter looks like, or there's a greater trochanter and a lesser trochanter of the femur bone. So we're kind of towards the greater trochanter. We're at the bottom edge of the glutes. We're still on muscle. We're not directly on the bone per se, but we're right along that edge. Then you can come straight across from that towards the tailbone. So you can find two spots as you move towards the tailbone. This is more of a direct, straight up and down. I am leaning just slightly to my right so I can have more weight on my right butt cheek. And then I'm going to move it over a little bit closer. So there's 2 points that are equal distance between the greater trochanter and the tailbone, and that's your piriformis. It's a very deep, problematic muscle because the sciatica nerve runs underneath it. And so sometimes people can have very tight piriformis muscles. It can get a little inflamed, so we just want to watch that. We can even go a little closer to the tailbone, see if we find anything. Another area is just directly by and around that sits bone area. Sometimes you can have a little bit of tenderness around there from the gluteus maximus. So you can just kind of play around and see if you can find anything, and if you do, just stay on it. Then we're going to take our ball and we're going to move to the very top side of this sacrum. Remember, that's that triangular shaped bone underneath your lower lumbar, and we're going to the very right edge of it. And remember, it kind of diagonals down towards your tailbone, okay? Comes to a point. So we're just going right along that edge. I don't have a lot of tension. I get a little bit more towards my tailbone. So I would pause there and feel it. Now, as you get used to doing this release work, what you want to do is you can start a little bit of movement. Like you might play around with bringing the knee out and in and letting that sort of help massage out that area. You could slide the leg in and out. You could turn it inward and outward, do a little waggle. But I would say, especially initially, we don't want there to be a reflex that kicks in where it's guarding that area. So typically in this area, I would say just try to breathe deeply, relax into it. Eric Franklin has a wonderful little cue that he talks about, imagining that that knot is like crystallized honey. And as you breathe, it's like you're sending warm water to that crystallized honey, and it just starts to melt and ooze into the liquid golden goodness that we know. And I love creating images like that because it helps me really center into my body and feel what I need to feel. Then you can move to the other side and address the other glute. You may find that one side is a little tighter than the other. We tend to lean to one side or the other as human beings, and so don't be dismayed if you find that you're a little bit more tight on one side than the other. And then I would recommend doing some gluteal stretches. So you can do something like, you can do some internal rotation back and forth. You can go back and forth. This also helps stretch out that outer quad muscle. And so you can kind of reach. You can cross one leg all the way over. You can pull that knee a little bit this way and then feel like the hip is weighted downward and towards the table. It doesn't have to touch. It's okay, but you'll feel a nice stretch in the glute. You can also, on your back, you can do the figure 4, but here's a little test. We can move our figure 4, we can play with the rotation. We can rotate in a little bit towards the opposite shoulder, or we can come straight in, or maybe we want to shift it this way a little bit. Just play with those stretches a little bit. Don't be afraid to move and stretch out those glutes. Another fabulous stretch I like, if you're able to be in this position, if your knees allow, is to do a big crisscross over and then lean forward. And that really makes me feel like I'm flexible. I feel like my chest can go down to my legs, and it's a brilliant stretch for those glutes. Again, you can kind of drop the hip a little bit and feel it a little deeper, but that just really can help open up those areas of that gluteal complex. Thank you so much for watching. Again, I'm Rebecca Cook with Bella Pilates.